Okay. So Walaa Hussein, Walaa Elzuber. Right. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting speaking sessions for the doctors. These are the daily dosage, profession-specific speaking materials, and medicine profession-specific speaking tasks. Hello, Walaa. This is the card for you. You have prepared it. And now we are going to start the session. Yes, Walaa, you can start now.
Hello, I'm Walaa, the treating doctor for today. How may I help you?
You can call me Lincoln because my name is Abraham Lincoln.
Hello, Mr. Lincoln. How are you today?
What to tell you, doctor? I am a little upset and worried. I am tired. I cannot use a word. I'm very much worried about this tiredness. I'm concerned about my future. What am I going to do like this? Can you help me, doctor? I need your support and guidance. Please, doctor.
Yes, I appreciate your concerns. It's not easy to have this surgery, but I want to reassure you that this is a minor surgery and you will recover your health sooner if you follow our advices. Now, before we are going deeper, I want you to tell me more about your problem.
Yes, doctor, I will definitely share because this concerns my life. It's everything for me. I have never faced this problem before, such a serious problem, and I want to come out of this situation. After this, problem, and I am no more. I don't know. It's totally, deteriorated my mental, physical, and everything. Everything is destroyed. All the setting. I don't know how I'm going to regain back to normal. Regain to normal, come back to normal. I don't understand. Doctor, your help is all that I needed. Please do something, doctor.
Yes, I appreciate your concerns and I thank you for sharing me with your concerns. Actually, some fatigue at this stage is acceptable and it's normal. Nothing to be worried about. Um, Now, let us let me to tell you some advices on how to recover your health and your energy. Would you like to hear more about that, Mr. Lincoln?
Yes, doctor. I will be
Okay.
very much pleased. Thank you. Come on, go on.
Okay, I would recommend you to join something called cardiac rehabilitation program. Have you ever heard about that?
What is this, doctor? I don't know a bit about it. Can you explain me in detail?
Yes, let me explain it. Cardiac rehabilitation program is a program made specifically for cardiac patients to help them to recover their normal lives and normal energy and to return back to their work and normal life activities. So they are in the Center for Rehabilitation. They will give you some exercises, step by step recovering you and your energy back to normal. So do you have any question at this point, Mr. Lincoln?
Okay, doctor, I am ready to follow all your suggestions, but I have one question, a very big question. I
Of course.
don't know, because whenever I do some exercise, slight exercise also, and if I walk a little distance also, I feel that, I feel this pain, and, I fear that this exercise and these activities might provoke a relapse.
Yes, it is right. What you said is a real concern, but I want to emphasize that importance of exercise after this event, maybe 2 weeks after this minor problem is all right. It doesn't have any problem, and moreover, exercise is very important for cardiac patients as exercise may make lowering the cholesterol level in our bodies because it leads to losing weight and burning some calories. Does that make sense to you, Mr. Lincoln?
Yes, doctor, that's really fine. That's very good what you say. But how much of physical activity is advisable? Can you tell me? And what type of physical activities?
That is great question, Mr. Lincoln. If you follow the cardiac rehabilitation program, they will go with you step by step and give you the exercise level which suit your problem and your needs. So they will start with you some warming up exercises like walking, running, and don't worry about what type of exercise you are suitable for because they will be watching you with during all your journey. Okay, if that's clear for you.
That's fine, doctor. And I want to ask you, I really want to resume work. When can I return to work, doctor? Because, I am an office worker sitting at a desk all day, and whether this condition of mine will make me an invalid for the rest of my life. I want to know. Please suggest me.
Oh, really understandable. Okay, your question is great because you need to ask before resuming your work. So you need, after a minor surgery like this, at least 4 to 6 weeks before resuming and coming back into work, normal work. Okay, Mr. Lincoln?
Yes, that's fine. And what else can I do? What are the things that you can suggest me so that I can reduce or avoid the risk of further attacks?
Great. Now let us talk about prevention. And prevention is better than cure, isn't it? Let us
Yes,
talk
doctor.
about, okay, thank you. Let us talk about prevention and how to deal with that things. First of all, I would recommend following a healthy diet um, because that will help you to reduce weight and to control cholesterol level on the blood. And these things could be achievable by taking some advices from our dietitian team here in the clinic. If you want that, I will connect you to them. They will give you some good, healthy options that suitable for you. Is that okay?
Yes, doctor. That's really very nice. Thank you for all the suggestions you have given, and you're so kind and patient. I really appreciate your kindness, doctor. Have a
You
nice
are,
day.
you are welcome anytime, Mr. Lincoln. This is my card. You can call me at any time if you have any question.
Okay, fine, fine. That's very good. Thank you once again. So, shall we switch on to the feedback?
Yes, of course.
So now, Walaa, Elzuber, you, I can say it's a mix of feelings. Okay, first thing is fluency. Fluency, focus more. The fluency is well, but the tone is very low, a little higher tone, a little higher. You're very low tone you're talking. So that's fine when, okay, but here we are. Okay, even in the interview also, it's better that your tone should be higher than the patient.
Okay.
Your tone should be higher than the patient. Your tone should be command. Here, I am the teacher. That is a different thing, totally different thing. So automatically my tone will be higher than you. But when I pretend as a patient, my tone will not be higher. I will pretend as if I am a real patient. Then I will have my own tone, different tone, not as a teacher, but as a patient. So the, angry tone, upset tone, worried tone, whatever tones. Okay, that is it. Then afterwards, this your tone should dominate mine. Your voice should dominate mine. You should be powerful. You are powerful. Okay, you are powerful. You should ask me. Then after, yeah, you're right. That's absolutely fine. There is nothing to be alarmed about. Why are you worrying when there is no need? Okay, let me give you some idea. There are many people who have faced this problem. Number of people got this had this myocardial infarction. Are they not managing well now? Yeah, so you also can do it. So what's the wrong in it? What's the problem in it? Definitely, you can overcome this situation. And being scared all the time is not going to help you. Okay, if you feel that heavy exercise is a problem, reduce the exercise. But exercising is a must. If you feel that it's going to be a problem, reduce it a little. And I'm there. Any problem, anytime, just ping me, just call me, and I'm there for you. I'll give like that. So that, at least 4 or 5 sentences at a stretch. Next one, accuracy. Accuracy, I don't have any problem with your accuracy because you have grammatical knowledge and it is sound. Okay, confidence level is also high. Confidence level is high, but the tone, the way how you are presenting, that is little low. Okay, subject confidence, subject level, subject knowledge. You are an expert. You have a lot of wisdom regarding your subject. What's regarding myocardial infarction? What happens in myocardial infarction? So you have an idea, and that's the reason why you are talking in depth about that. Next one is common sentences. You are speaking ordinary sentences, normal sentences, the sentences which any Tom, Dick, and Harry can use. Then what is so special about it? So use some sentences with, for example, do you understand? Is that okay with you? So like this. I strongly believe that if you follow these medications and exercises seriously, definitely there will be a great progress in your recovery. Trust me.
Yes.
Trust me, you will definitely increase the speed of your recovery at a rapid pace. You will recover. Whatever you want to say, like that, you can say. And then how does that sound? What do you think about that? These are ordinary sentences. Look of something special. They look something special, but just how does that sound will not add you anything. Speak something, then you say, how does that sound? Is that okay? These are only ones. Don't say, what do you think about it? Is that okay? How does that sound? Just like that one. Now let us see one example here. Right now, I think you need more time to recover, at least a fortnight. Then we can have a review, and then I can suggest you regarding your work. But now, definitely no. Please relax. Give your body time to recover well. Don't give it pressure before time. Once you're fully recovered, then you can participate in your professional activities with double power. But until then, now your body and your mind is weakened. So let it regain its fullness. So after a fortnight, I'll come back and we'll assess your progress. Then I will suggest you. But until then, trust me, you need to follow all these things. So this is the way how you can talk. The next one, use quality sentences. What do you use qualities? The same thing in qualities. Unless and until your health is recovered, you cannot participate in professional activities. So better not to think of it in the near future. After a fortnight, after completing another assessment test or review, we can have a detailed review, and then I can suggest, we can consider resumption of professional activities. Until then, relax and slowly participate in physical activities. Then use a simple complex compound sentence. What are simple complex compound sentence? Simple sentence. What do you mean by simple sentence? Now I'm giving you two ordinary sentences. You worked hard. You work hard, you will pass. You work hard, you will pass. Now these are ordinary sentences. They are not simple sentences. They are ordinary. Simple sentence is a very special sentence. You don't know that. You work hard, you will pass. Walaa Hussein, you work hard, you will pass. Two sentences. You work hard, sentence number one. You will pass, sentence number two. So now these two sentences joining these two. If you work hard, you will pass. This is complex sentence. Work hard. Okay. If you work hard, you will pass. If you do not work hard, you will fail. Work hard, otherwise you will fail. Work hard and then you will pass. Work hard so that you may pass. So that you may pass. Work hard so that you may pass. Unless and until you work hard, you will not pass. Hard work will make you pass. Okay, so like this, different sentence. Now I will be giving you another example. He is rich. He did not pay the fees. A schoolboy. He is rich. He did not pay the fees. So, in spite of being rich, this is simple sentence. In spite of being rich, or in spite of his riches, or in spite of his wealth, in spite of having wealth, in spite of being rich. So, like this one, in spite of, or despite being rich, he did not pay the fees. In spite of being rich, he did not pay the fee. Despite being rich, he did not. In spite of and despite, you are using simple sentence. Same sentence, you are using complex sentence. Though he is rich, he did not pay the fee. Although he is rich, he did not pay the fee. Even though he is rich, he did not pay the fee. These are complex sentences. He is rich, but he did not pay the fee. He is rich, and yet he did not pay the fee. These are compound sentences. So complex compound sentences, you use conjunctions to join these simple ordinary sentences too into making to complex compound and simple sentences. So is that clear, Dr. Walaa Hussein?
It's very clear. Thank you, Mr. Peter.
Okay, every day I'll give you, today I gave you 7 points. These are the 7 points I gave you every day. Okay. These are the 7 points. One doctor. She prepared with me for IELTS. She prepared with me for IELTS and she got the result and she's very happy. She's saying she got the result yesterday. She's saying, I'm very happy. Yes, very good. Congratulations. Okay, right. So, that's the end of our session. Right.
Mr.